Welcome to ENACT Day 2021, our 17th annual ENACT Day. We old, y'all. We've been doing this for a long time. We're excited to have you in our presence and be a part of this fabulous day. If you haven't already, we're just asking that you put your name, pronouns, and location in the chat. We definitely want to know who we have in the room. We also want to let you know that if you need interpretation, there is interpretation being provided today in Spanish and in Thai. You can click the globe at the very bottom of your screen. And let's go ahead and get into this. I am D'Angelo Mack. I'm with Public Health Advocates. I am your MC today on this fantastic voyage. We currently have over 112 people in the chat, and we're just really excited to be here today. We're going to move to the next slide. Actually, maybe let's go back to the other slide just to make sure folks were able to see it. I'm not sure if I moved too quickly. This is how you access the translation for today. All right. Next slide. So definitely really excited about being with you all today. We have a full packed agenda. We definitely, again, want to know who's in our room and among us. So if you can, just go ahead and introduce yourselves in the chat. We don't have enough time to go around and talk to you individually, although we would love to. But go ahead, put your name and pronouns and location and possibly organization in the chat if you haven't already, so that we can continue to know who's here. If you're using social media, we ask that you, if you can, mute your line as we go forward, so that we can all hear who's speaking at one time. So ENACT Day 2020 or 2021, we're asking that you use that hashtag in all of your social media posts today. That's again, hashtag ENACT 2021. Next slide. Next slide. I want to definitely give a huge thanks to our coordinating organizations, our planning committee and our advisory committee this year. These individuals have helped us orchestrate this great day. And without these individuals, this wouldn't be possible. Absolutely one of the best coalitions I've ever been a part of. And one of the best days we get to celebrate with all of you. So thank you, partners, for helping us craft this day and put this on for all of our community members. Next slide. So public health is on the legislative slate again this year, as always. Numerous bills would have a lasting impact on the health and well-being of California communities in a time when it's more clear than ever how critical protecting our collective health is amidst COVID-19 pandemic. Protecting public health means strengthening the foundations that support our communities, health, affordable housing, healthy environments, just workplace policies, and approach and decades of disinvestment in public health infrastructures and the erosion of critical health supporting resources have made everyone vulnerable to the current health crises. This legislative cycle We have the opportunity to turn a new page in this story and build a stronger, more just, and healthier tomorrow for our Californians. We are all advocates, and we are all in this together. Next slide. So today, the breakdown of the agenda is as such. As you see, we are currently in our town hall. After we discuss the agenda, we'll move into a video montage. After that, we'll have a campfire discussion with the great Dr. Flojaune Cofer and Dr. Rhea Boyd. And moving through that, we'll go over our policy platform overview for the day. So we're all in line with what we'll be talking about later on in our overview for our legislative visits, and then we'll close. We're asking that folks who signed up for the ledge visits join us at 11:30 to have lunch together and talk a little bit more about strategies in talking to our respective legislators. For those who are joining today through ENACT Day, we definitely want to provide lunch. So if you've provided us with your email, in the very near future, you'll receive a gift card for lunch on ENACT Day. And then at 12, we'll be moving into our legislative visits. We'll get a chance to talk to our respective assembly members and senators about the priority bills that we selected for this year's ENACT Day. All right, so without further ado, we'll move into our scheduled agenda, and I'll pass it over to Vince. Vince, take it away.
Hi, everyone. So we're here today because we see a vision of a future where all people can live healthily and happily. Many of the bills that we are advocating for today are steps towards that future. We wanted to give an opportunity for participants to share what their vision for a post-pandemic world would be. And we're proud to share this video highlighting those visions for a post-pandemic world.
As we begin to emerge from this COVID-19 pandemic, what's one vision you have for a post-pandemic world?
Hi, everyone. One vision I have for a post-pandemic world is a world where there's respect, yet have a sense of family and warmth from the community as a whole.
I imagine a post-pandemic world where all Californians can engage in healthcare without worry.
Hello, my name is Yasmin Dawson. I live in Lompoc, California, and I'm a community activist and a member of the C4 organization here. What I envision for our country and community is the insurance of safety. During our pandemic, it was proven that we had a lack of protection for those in our communities. My hopeful expectation is that by the good leaders and citizens will fulfill the need to make
Hi there, my name is Kira, and my vision for a post-pandemic world would be for each of us to extend empathy, compassion, respect for our neighbors, for our friends, for those we do not know or may never know, being able to have feelings of unity and coming together in order to get through some of the toughest times is what I would envision.
In California, we need equitable, affordable housing to reduce systemic caused trauma in our communities and food for everyone living in California. So no one goes hungry in the state that grows the most food in the country.
Hey everyone, this is Cozy Blow representing Santa Barbara County and Collective Cultures Creating Change. My post-pandemic vision would be for a world that recognizes that intersectionalities matter, a world that sees our Blackness, acknowledges our experiences, and does not look away.
Thank you for all those who provided videos for today. We do appreciate you taking the time to speak about your vision for a post-pandemic world. Next slide. Great. So now we're at the portion of the day where we get a chance to talk to two dynamic speakers about transformative change for health equity in California. These two individuals are leading the way when it comes to COVID-19 information and providing us with rich understanding around vaccines. We are pleased and privileged that they have taken the time to join us today. I definitely know how busy they both are, so tremendously grateful for them. I'm just going to go ahead and read bios for each of them, and then we'll go ahead and get grounded and talk a little bit about our topic. So first, we'll start with Dr. Boyd. Dr. Rhea Boyd is a pediatrician, public health advocate, and scholar who writes and teaches on the relationship between structural racism, inequity, and health. She has a particular focus on the child and public health impacts of harmful police practices and policies. She serves as the Chief Medical Officer of San Diego 211, working with navigators to address social needs of San Diegans impacted by chronic illness and poverty. And she is the Director of Equity and Justice for California Children's Trust, an initiative to advance mental health access to children and youth across California. Dr. Boyd graduated cum laude with a BA in Africana Studies and Health from the University of Notre Dame. She earned an MD at Vanderbilt University School of Medicine and completed her pediatric residency at University of California, San Francisco. In 2017, Dr. Boyd graduated from the Commonwealth Fund Mangan Minority Health Policy Fellowship at Harvard University School of Public Health and earned her MPH. Welcome, Dr. Cofer. Dr. Cofer, Dr. Flojaune Cofer is an epidemiologist who serves as the Senior Director of Policy for Public Health Advocates. She manages a team of staff leading health equity initiatives focused on California state policy, boys and men of color, community-based 911 response, transgender health, youth trauma prevention in cities, student wellness in Boyle Heights, and most recently, public health response to COVID-19. Her professional interest in addressing emerging and persistent public health challenges through research, policy, and community engagement. Her work primarily focuses on public health prevention and restorative justice. Prior to joining Public Health Advocates, she led the Preconception Health Initiative for the California Department of Public Health. Flojaune received a bachelor's degree in chemistry and women's studies from Spelman College. Her public health training was at the University of Michigan School of Public Health, where she earned a master's in public health and a doctorate in epidemiology. Super excited to have both Dr. Cofer and Dr. Boyd with us today. Amazing rock stars in their field. I feel like there should be some air horns going off behind me, maybe some, fireworks of some sort. But thank you both for joining today. Let's hop into this conversation. And I want to start with you, Dr. Boyd, because you wrote an op-ed piece in the New York Times entitled, "Black People Need Better Vaccine Access, Not Better Vaccine Attitudes." I just want to know, what's the understanding of this article, why you wrote this article, and the importance of the hesitancy around vaccines?
Well, first, thank you so much for having me at this year's ENACT Day. I'm so excited to be here and to talk with Dr. Cofer as well. The article felt really important to say because there has been this kind of public discourse that arose during the pandemic once the vaccines became available that said that, Black folks are quote unquote vaccine hesitant. And that really worried me because all of the evidence that we saw showed us that Black folks in this country, including in our state of California, don't have equal access to the COVID vaccines. You know, I can give you a number of examples, but perhaps the most powerful one is just looking at what happens when you choose to prioritize vaccine access based on age. The vast majority of adults in this country who are above age 65 are white folks. And so if you just use age as your cutoff, which most states did early on in the vaccine effort, you exclude Black folks from having early access to vaccine. That then compounds access issues that have always existed in communities of color and Black communities that don't have equal access to other sources of primary care. And so right now, it's really troubling is that even though we're seeing cases of COVID tick down and the mortality rate of COVID tick down and hospitalizations tick down, Black folks now have the highest COVID mortality rate again. Early in the pandemic, Black folks had the highest COVID mortality rate. Then Indigenous populations for about 6 months in the middle had the highest COVID mortality rate. And now Black folks have the highest COVID mortality rate. And when you pair that to the fact that Black folks are the least likely population to have at least one dose of a COVID vaccine, we are facing an enormous access issue. And when we instead just blame Black folks and say it's because of your own quote unquote mistrust that you're not getting this vaccine, it means we're not taking seriously Black folks' structural analysis of our healthcare system that has not treated them fairly, and Black folks' real need for convenient, reliable access to information about the vaccines and to actual vaccine.
That's great. Dr. Boyd, can you speak a little bit more on the compound issues, the statistics you gave about, people of color being the highest mortality rates, Blacks being at the top of that list. Can you speak a little bit more about why that might be, the compound issues that we might be seeing?
Absolutely. I think this is it's a question that we as a country had to answer this year, which is why do folks of color tend to be sicker overall than white or more wealthy populations? And it's because of the forms of inequality in our society, and COVID laid all of those forms bare. So we know that folks of color tend to be disproportionately employed in professions that require sufficient or a lot of public interaction. So people who work as essential workers, who were unable to take time off work, were in work environments where they were exposed to other human beings, which potentially exposes them to COVID. At the same time, we didn't have a government response that gave everybody access to protective equipment. We prioritized healthcare workers for access to the lion's share of PPE in this country. The vast majority of healthcare workers in this country are white folks. And so again, we don't allow all essential workers, all of the workers that we were calling heroes, we didn't allow them equal access to protections in their workplace, even as we asked them to return to their food services work or to working in, food supply chains. And so what we saw is that Black folks were disproportionately exposed. And at the same time that they're disproportionately exposed, they were left outside of our healthcare system's response. Black folks live in neighborhoods at baseline that don't have equal access to primary care services, that don't have a regular provider. Black folks are one of the populations, and Latinx populations, that are the least insured in the country. So that means you don't have a provider you usually go to get your health care, which means if you have COVID or you're worried that you have symptoms of COVID, you don't have a place to turn. And so for a lot of folks, that meant higher mortality rates, that people would wait a long time to go in because they were concerned about the cost of their care. They would come in when they were sicker and have worse outcomes. And so I think COVID has really made very clear the failings of our healthcare system to serve everybody well. And honestly, some of the underlying problems with our political economy that really allows too many people to go without the basic resources they need, like safe housing and adequate food and, workplace protections that might enable us all to live healthier lives.
Yeah, that's amazing. These are things that our community has known, forever, but it feels like COVID kind of ripped the blinders off of society and magnified the vision of what is happening in communities of color across the country. Thank you. Dr. Cofer, I'm going to come to you next and ask, recently public health advocates launched California COVID Justice, Recovery, Response, and Repair. Can you please share with us why this was created and what the project plans to do?
Thank you, D'Angelo. First of all, I just want to say it's really a pleasure to be part of ENACT Day this year. I've been a part, I think, for the last 5 ENACT Days, and so this is really just an amazing opportunity. Recently, public health advocates, along with many partners, some of which are probably attending ENACT Day today, came together to launch California COVID Justice. And the idea behind it is that we want to use this opportunity where we are all in a global pandemic that has laid bare so many of the structural inequities that Dr. Boyd was just talking about. And we want to use this as an opportunity to not just get this right, but also as a launching point to get many other things right. And so we brought together this steering committee of people from across the state that include, some of our public health medical officers and some of our contact tracers and people who are working in housing and homelessness and working on racial inequities. And we're bringing them together to say, what do we need to do right now, right? We chose those 3 R's really seriously. Like, what do we need to do right now to recover and respond? But also, what do we need to do to repair? Because part of what we have to appreciate is that there was already, an underlying system of inequity, and then we just layered COVID-19 on top of it and caused further harm. So we can't just continue on. Even if we were on a good path to recover before, which we weren't, we now have changed the inflection point of what that looks like. And so we have to really be thinking about this as we're going about not only our COVID response work, but all of the work that we're doing in general, because we've changed the landscape for everyone. And so because of that, the initiative has chosen 3 main priorities to work on. And these priorities are for our state as well as local legislation throughout California. And they are racism as a public health crisis. So really diving into what it means to look at racism as a core structural function of our government systems. And then what are we going to do to be able to mitigate or eliminate that harm that is being infused into every single one of our practices. Then looking at economic support, right? How do we support families and communities, but also how do we make sure that our communities have the same economic opportunities for support and investment throughout Black, Indigenous, and other people of color communities. And then lastly, for housing and homelessness, recognizing that in particular, when it comes to housing and homelessness, this is a time where a lot of the trends that were already happening in California are even worse. We have a bunch of people who already could barely afford to live, and now they are going to be, by the time these protections run out, 2 years behind on rents and mortgages. A question that we've kind of kicked the ball down the road on, but we haven't actually been able to address yet because we haven't decided what we're going to do with this accumulating debt. And so this is going to be, we're finally talking about student loans, but this is going to be the other. It's going to be rental and housing debt. And what happens when you owe $30,000 in back rent and now you're being charged interest on it, or you're being, the inevitable has been delayed, which is that you're going to be evicted. And so we have to have these conversations right now and recognize that they are part of the conversations that many folks were already having prior to the pandemic.
Great points. And I love the 3 areas that you're focusing on: racism as a public health crisis, economic support, and housing and homeless. These are areas that are constantly before us. The racism as a public health crisis is gaining momentum across the country. I understand that California still hasn't declared racism a public health crisis. And so there needs to definitely be a push by this group, by the folks on the joining us today, to really identify those things that are historical and really take a look. And we have some legislation that are priority bills that kind of address those things today. So we'll talk about those a little bit later. I want to get into, vaccinations and just the thought around that, the collective thought. Now, we have more and more folks being vaccinated now, so that's a really good thing. But there's still a lot of vaccine hesitancy, even more so with the Johnson & Johnson recall. And so I wonder if either of you would talk about, what you would tell someone. And we got some questions from some younger folks and other folks in community, but questions about, with the Johnson & Johnson recall, more folks are now skeptical about receiving the vaccine. What would you share with them in order to help, change their mind or move them into a position where they understood a little bit better?
Yeah, this is a really challenging, conversation to have because, when Dr. Boyd was talking before, one of the things I wanted to add to this conversation is how even the narratives that we share about people are racist, right? So lots of people were concerned about the vaccine, and I hated the way that it was called hesitancy or skepticism. People had questions. And so if you came up to me right now and said, hey, do you want to buy this house? Or do you want to go on vacation with me? Don't call me skeptical if I turn around and say, well, where are we going? How much is it going to cost? How long are we going to go? Right? I should not be expected to just be like, yes, obviously, let's go, right? And so the idea that people had questions, and if they were put on the spot and asked, do I have to give an answer right now? My answer would be no, is a way that we were essentially demonizing, in particular Black communities, because the headlines were not about our Indigenous folks and our Latinos and our white people who had the same questions. They were all about why Black people won't do this, why Black people are particularly deficient in a thing, why they don't want to save themselves. And so I just want to call that out as like a racist narrative that started from the beginning when people had questions. The other part is that, and Dr. Boyd pointed this out, is like access. One of the main reasons people were saying no is because they thought it cost money and they were saying, I can't afford this. So again, this is a question of like, investigate the no before you just go with your racist narrative of why people are saying no, but also recognizing that we should be asking questions. And this is where it becomes really complicated. And if we had done the work we needed to do over the last several generations, we could have this conversation more plainly. We know that vaccines can do a great deal of good in communities. And I want to underscore that point. And also, the current vaccines we have are under an emergency use authorization. What that means is that if we were not in a global deadly pandemic, most of us on this call right now would not have access to these vaccines unless we had volunteered to sign up to be part of the clinical trial that was studying them. Because while they have been determined to be safe enough to start a trial, and now they've been determined to be safe enough because of the looming threat, they are not fully approved. And so it means that we knew going into it that things like what happened with Johnson & Johnson might crop up, because when you're looking at safety data for a vaccine, the very rare events are not going to show up in your clinical trial. They don't show up until you have more people. Why is that? Because they're rare. And so if they only happen in 1 per million people or 1 per 80,000 people, and you have 40,000 people in the trial, that means you're not going to see them until you get to having about 80,000 people or so, most likely, right? And so that's where, some of this is just kind of how things work, but also it's one of the reasons why people said up front, I'm not sure yet, give me more information. And so recognizing that, yes, the threat of this virus is looming, but also the fact that we are still learning about this virus that didn't have a name until 14 months ago, and that didn't have a vaccine until, 5 months ago. Like, we're still learning, and we need to be in a position where we can both encourage and also at the same time respect the fact that this has happened. So here we are. Now there is a very rare blood clot that's not the same as the blood clots that's caused by, by birth control and other things, that is showing up in a particular segment of the population, younger women, right? Women under 50 or so. It's showing up rarely, but people have died. And so people have to really consider what that means for them. And when we went too hard in the beginning, telling everybody this is totally safe and you're, ridiculous if you don't want to get it, when this happens, now they're looking at us and saying, well, I had questions. You told me it was safe. And now you're halting, and that was the right decision to move, but you're halting, what we're doing with these vaccines until we can investigate further. How is that on par with the fact that you basically called me silly and unreasonable for saying I have additional questions and I'm not sure yet?
And I would only add to that. I feel like
before you answer, Dr. Boyd, just for our translators, we get excited talking about this. No,
I
it's
talk
okay.
very fast.
It's all right. It's all right.
I talk fast in English, so.
slow down just a little
Sorry.
as we're explaining these things. I'm gonna have you repeat everything you said later, Flo, for the translators.
Okay.
I'm joking. Go ahead, Dr. Boyd. Thank you.
Thank you for that reminder. I'm going to try to talk slower. For the people who were concerned about safety, that the process was rushed to put these vaccines to market, and that in that rushing, that the officials, the FDA, the CDC, the federal officials were then overlooking concerning signs, what happened with Johnson & Johnson should be a source of reassurance, right? 6 people out of 6.85 million had a serious side effect, and they paused everyone getting them. 6 out of 6.85. Now that's 1 in a million for all recipients, but if you're only looking at that slice of women, as Dr. Cofer said, who had it, that's probably about 1 out of 100,000 of folks who got Johnson & Johnson. So to see that the government took such extreme measures to make sure we fully understood if those unique blood clots were caused by the vaccine, who the vaccine is now safe for, and who should have their provider recommend a different vaccine for, is an important way that we watched the safety apparatus actually work in our favor. And so I hope people feel reassured by that, because we've also now at this point had hundreds of millions of Americans get the mRNA vaccines, Pfizer or Moderna. And we had not seen that same safety signal for the mRNA vaccines. And so if you're worried about the safety of Johnson & Johnson, particularly if you are a young woman under age 50 for any reason, get an mRNA vaccine, because it does not shown far more people have gotten those vaccines, and it did not have that same safety signal.
Thank you, Dr. Boyd. This is a great conversation, and I'm learning so much, as I always do, talking to both of you. I did want to ask, or let me just make a statement. If you have questions as the conversation is going forward, I know it feels like for me, it's just the 3 of us together. Like I got my coffee, we're sipping and we're talking, because I absolutely, fanboy these 2 doctors. But if you have questions as well, put them in the chat and we will get to them so that Dr. Boyd and Dr. Cofer can answer them. But there was a question from a young person that came through around contracting COVID, having COVID, and whether or not they need to have the vaccine. Can either of you speak to, that thought? A person having had COVID and saying like, well, I don't think I need the vaccine, or is there science to that?
So as a pediatrician, as somebody who takes care of younger people, I want young people and caregivers and parents to understand that while kids and young people don't get COVID as often, they absolutely get COVID. And that the kids who have had the worst complications from COVID have actually been Latinx and Black kids, who make up more than 75% of COVID deaths in children under age 18, and more than 75% of that really rare syndrome where you have this multi-inflammatory response where you have to go into the ICU for a period of time. So we see kids are affected, and like adults, kids of color are disproportionately affected with complications. And so it's really important that young people actually become vaccinated when their age group is approved and we know that it's safe. And as adults become vaccinated and young people become the clear population that have the lowest rates of vaccination, we're actually seeing, unfortunately, rates of hospitalizations and deaths in young kids increase. And it's only a sign that that is now the population that is the least protected. And so one way for families and caregivers to protect young people is for families and caregivers, if you are eligible for the vaccine, to get vaccinated so that you are not a source who can transmit COVID to your child or the young adult who lives with you. And then the next step will be for us to talk as a community about vaccinating kids once it's approved. Right now, there are clinical trials underway for kids 16 and below down to 6 months of age. And I just read earlier this morning that it seems projected that some of the vaccines, probably Pfizer, are going to become approved for kids maybe as early as this fall, which will be very important as kids return to school in person. And so it's very important for kids to get vaccinated because unfortunately kids can be affected.
Thank you for that. Dr. Cofer, do you want to add anything?
I think Dr. Boyd covered it.
All right, thanks. We'll move to the next question. There's a question here that says, how do you think we get there for better distribution of the vaccine? Because some people will never take it or trust the government because of the government. So, how what's your thoughts of how we get there around education and information, and this word distribution as well? I know that it's gotten easier to get the vaccine, but the process is still very, very difficult and complicated. So can you guys speak to that question?
Absolutely. So I feel like this is one of my soapbox issues. So I am going to try to say this as slowly as possible for our interpreters. What really is troubling for me, and I saw some of the comments that came up. I saw Veva in the comments and several others talking about what's happening in our communities. So when we talk about, education, the first step is just like Dr. Boyd said, access, right? So we're always in this position where when we have an emergency, we are trying to build the train as it's leaving the station. And so what that means is because we never stop and do the advanced planning, we didn't already have systems in place to be able to say who is going to translate materials, who are going to be our community partners on this, where are the vaccine or testing sites going to be set up, what are the hours going to be. We put so many of the materials online out of convenience and the assumption of widespread access, but it also meant that for people who don't use the internet in that way, that we had to then find a way to let them know they exist, and find a way to get that information to them. And so this is a real challenge for us because it means that as long as it took, right, and most of my relatives are, English speaking folks here, but some of them are older. It took a while to get information to them. Then imagine having to do it backwards and in heels, right? And so now we have to also translate these things and make sure that they get out to our communities. And so there's a delay. In addition to that, when we're talking about education and we're talking about, people who won't trust the government, there's also the conversation around, we've had issues with the public charge. We have been, deporting people, and we have been doing a lot of really harmful things to our other communities of color that have made it so that any point of access that's public is potentially a threat or harm. We've made schools unsafe places. We've made hospitals unsafe places. We have done this in a way, and then we turn around and say, please trust us. And the question is how? How do people trust us if we don't make these safe spaces? And so I think that's what the conversation has to be, is not just about how do we further educate people. That is certainly a conversation, because explaining a messenger RNA vaccine in a country where 77% of people don't have what people call a high enough health literacy to follow instructions on a medicine label is a problem, right? And that's a problem in and of itself. But you're layering that problem on top of the other very real issues of people's mistrust is well earned. It is well earned because of their interface with institutions and because we have made ourselves unsafe. And so we can't, again, do this blaming of communities that are scared or concerned without also validating the underlying reasons for that, and also then taking extreme efforts to eliminate those underlying causes of distrust. So it's education, it's also us being a safer community overall. And if we don't do both at the same time, we're not going to win. An education campaign is not going to change things by itself.
So good. It's so good, so good. If I had shoes on, I'd throw it Flo. And I know in some countries that might, but in our culture, that means she's talking good. Dr. Boyd, you want to add anything there? This is a great question.
No, I think she really hit it.
Love it. I love it. You know, there's a question in the chat that talks about, you lifted up, our immigrant family and the difficulty for them, the fear around, not being in a safe place, going to a safe location, or, the mistrust of government. Someone asked about family vaccination days and ensuring that immigrant families are able to get vaccinated at an in-culture or in-language pop-up site or safe spaces. Have you heard of these spaces, and what are your thoughts around them? Maybe, how do we create more spaces that are safe? Can you talk to that, speak to that?
Well,
I'm
Dr.
a big
Boyd,
fan of,
yeah.
Oh yeah, go.
Yeah, go ahead.
I was just gonna say, I'm a big fan of mobile vaccination sites that move to where people are, which sometimes will be a person's workplace. Sometimes it'll be their place of worship. Sometimes it'll be a park or recreational space, but it moves to where people are, so people don't have to come to it. So the first thing about that, I think, is mobile sites are highly effective. Second, I think we also have to have a conversation about the data collection that's happening at vaccination sites, which can be a barrier to vaccine uptake, particularly for immigrant families that may have mixed status. So if you have members of your family who are undocumented, folks can have reasonable and credible fears about being asked about their immigration status at the vaccine site. The federal government has decided that those questions will not be included in the questions asked at the federal sites. So those are the max vaccination sites, like the ones, at the Coliseum, or the pharmacy vaccination sites. But if you go to, for example, your provider, each site can ask a different set of questions. And so as community advocates, I think we also have to check ourselves on the type of data we need as people make this critical choice. And is it more important for us to know even just your race and ethnicity, your sexual orientation, your gender? Like, do we have to know that? Or if you decline those things, can you still get the vaccine? Or could we ask you those things after you get the vaccine and people have full knowledge that they can refuse to comply? Because we need to make sure that I think it's not a barrier for folks. And then the last thing I'll say is, if you're going to have a day where you're encouraging people to be vaccinated, I think it should be a 24-hour vaccination site so that people can come who work a double shift, who, keep odd hours, who work night shifts, so that it's clear that we will be here for a full period of time, and so that people can stop by without an appointment. As Dr. Cofer said, the online system to sign up is a major barrier for most communities of color, for anybody who lives in rural America, including rural California, who don't have reliable broadband. And so instead, if you bring the vaccine to people where you don't have to sign up because there are no appointments, you just get in line, and when it's your turn, you get vaccinated. Those have been shown to be some of the most effective ways to vaccinate communities of color.
Yeah. That's great. Go ahead, Dr. Cofer.
The only thing I would add to that, because Dr. Boyd really covered it, is that family vaccination is how we should have handled this from the beginning, because so many people were showing up, especially in the early days, and bringing family members who they lived with to be vaccinated. And those family members may have been older and may not be working, and were eligible, but they were working and they were the high risk folks who were working frontline, public facing jobs, and they weren't going to get vaccinated for another 3 or 4 months. And so recognizing that we exist in our pods, and so the pod gets vaccinated together, a household gets vaccinated together, because they're not going to be wearing masks most likely indoors with each other, and that's the highest likelihood of risk. of transmission. And so that should have been the way, instead of tiers and phases and doing it in this way that doesn't recognize the way we're organized, which is families and communities. That's how we should have started this. I think the other piece of this is, as we're talking about, and there's some really successful models that of work, and Dr. Boyd was talking about it, and I see some even being lifted up in the comments. And these models worked, but the challenge was how much time it takes. And I know that, sometimes we can't rush, but that's where the emergency preparedness comes in as a public responsibility, that we should have already had a phone number set up where when there's an emergency, whether that's a wildfire, whether that's a pandemic, whether that's a hurricane, a tornado, a tsunami, whatever it is going to be, that there's already stuff set up. And there are already places that are known to people prior to the pandemic, and they already have PPE on site. They already have a way to be able to, if they need to reach out to, kind of like firefighters, emergency folks who are tapped in when there's an emergency to come and work, that all of that is already set up. And that, that we can engage our community health workers and our cultural brokers and our promotoras in this model in advance, not building it months after, because for every single day of delay, people are harmed. And we were put in this terrible position of having to say, are we going to shut down schools and stop kids from getting meals and not know what's going to happen to those kids, not know if their parents still have to work and they're going to be home alone? Or are we going to expose them to a virus? And that is a terrible either or question. It should be, we don't have to do either because we already are ready for this. And here is the plan. And that's what I'd like to just lift up for us, is that if we can just reserve some of our bandwidth to not be in emergency response mode, but in planning for the future mode, we could save a lot of lives for so many different reasons.
So good. Dr. Boyd, you're on mute if you're.
Sorry, I'm just here mumbling to myself. Yes, I completely agree. Amen. That was yes to all of that, because I think what we've seen, and I want to give credit, honestly, to the Black, Pacific Islander, Indigenous, and Latinx healthcare workers who have built this emergency response basically overnight, is that they've illustrated the ways that our healthcare system already should have worked. Why isn't healthcare mobile? Why don't people have access to these resources right in their neighborhood? If it makes so much sense to have people get vaccinated in the parking lot of a church, why isn't there a clinic right there so they don't have to go to the emergency room? I mean, I think we built an infrastructure really quickly that I would love to see receive the funding and support it needs to kind of last post-pandemic, so that everything we built that has been reliable to disseminate a vaccine to 80% of the US population in like 6 months is what we leave behind as a legacy should we need another emergency response.
That's great. And this is all this is all powerful. And Flo knows me, I'm all about recordings. So we are recording this session. So we'll make sure that this recording is available to the participants later on. This has been some amazing conversation, and I hope that participants, picked up something. I know I have, and just, we'll run with it. These are the types of conversations that we need to have in our communities with the people closest to us. Because trauma is real, right? And we need a better understanding of what's needed to continue to move us into healthier spaces. And so I thank you both. We have a last question that we'd love for you to answer. As you saw our video series before, we were asking folks what their vision was of a post-pandemic world. And we'd love to hear from you. What is your vision for a post-pandemic world?
I can start. My vision for a post-pandemic world is that we finally, as a society, do the thing that we should have been doing all along, which is setting aside some bandwidth so that we are similar to the way that we're all encouraged to save for retirement, and not to touch that money, and get brought into that over time so that it's available to us when we're older. And of course, there are a lot of problems with that model, but I think that as a society, we need to set aside some
ฉันคิด
bandwidth
ว่าในทางสังคมแล้ว พวกเรา
issues, be able to do some real advance,
มีความสามารถที่จะ
as opposed to always having to address the crisis du jour, right? Every single day, there's a new thing that takes our attention away, and we never get to take a step back and have a core of folks who are really planning for the future and making it so that we can get out of crisis mode always, and we can actually think about what we need to make sure that we A, have fewer crises in the future, and B, when the things that we can't avoid do show up, that we're prepared for and we can mitigate the harm that exists. And so I would love for, 20 to 30% of our municipal government budgets to be set aside to do some long-term restoration and repair and planning, so that when things come up, it's not left to individual families to have an emergency kit and to fend for themselves. But as a community, we're saying these are the things we have in place for you, and this is the system that is ready to be activated when things happen, and these are all the things we're doing along the way to make it so that we're also planning to make sure that that's not a worst case scenario. And I think that's what I hope from this, is that we learn that lesson well, that how we approach this cannot be the way that we go into anything in the future, because we barely got through it this time, and we really could face a total collapse in the future.
Thank you, Dr. Cofer.
I think I would hope in a post-pandemic world, we do two things at least: universal healthcare and defund the police. I think the pandemic has made clear that we do not have equal access to healthcare in this country by race and ethnic group, that we segregate that care by race and ethnic group, and it kills people. And so we have to make sure that insurance is not a barrier. Cost is never a barrier to anybody in this country having healthcare services in a crisis like a pandemic. So universal healthcare is number one. And I saw someone put in the chat that nobody wants to fund this infrastructure, but we all know where that money sits. In most cities, the largest single item on the budget is law enforcement. Instead of policing our communities, we need to invest in our well-being and our thriving. And so I absolutely think defunding the police is a public health strategy to ensure we have the resources we need to promote, health and well-being.
Yeah, so now that I've thrown both my shoes at each of you, I just want to immensely thank you for your time and your wisdom and your efforts in our community to continue to push for the betterment and health well-being of the people we serve and love. So thank you, Dr. Boyd. Thank you, Dr. Cofer. I think both of you are sticking around with us for a little bit. If you can, please put your social media handles in the chat so folks can follow you. We'll also send those out later. But again, just thank you immensely for your time and all that you do. Great. Let's give them a hand. We'll move to our next portion of the agenda, and I'll pass it to my partner, Gabby Tilley. Gabby, take it away.
Thank you, D'Angelo, and thank you to our speakers. That was incredible. All right, so now I'm really excited to present to you our 2021 policy platform. So as Flo was talking about, there's a lot of mistrust in government, and that is well earned. Well, we believe that our state government can begin to build trust by responding to the policy violence of public charge and other racist exclusionary policies with inclusive legislation that recognizes all of our humanity and amplifies the intrinsic power that we all have to live healthy lives. So each of the issue buckets that we have here for our policy agenda relates to a social determinant of health, right? All of these things impact our ability to live healthy lives. That is economic justice, the amount of money that we get from our jobs and our ability to take time from them when needed. Accessible neighborhoods, this relates to the availability of housing, as well as parks access and environmental health and safety. Healthcare access, right, critical and related to the topic we were just discussing, but all the time, every time, healthcare is required. Healthy food access is critical. Food is the basis of life. We all need to eat it, and it's a failure of government when we have such high levels of hunger, and they can address it. Which brings us to equitable governance, right? The ability of our government to respond to its need to change how it operates in order to be able to enact equitable policies. And community safety, right? Addressing the trauma of violence and the brutality of our institution of criminal justice, and changing that so that we can end that trauma and violence and set forth a new path. So I will now take us through each and every one of these categories. We have 2 bills in each category, and we have some incredible speakers that I invited to join us today who can help let everyone know why we need to pass these bills. So this is going to be kind of a speed round. I'm going to give everyone an opportunity to give their elevator pitch in 1 minute. Why do you think we should pass said bill? Let's pretend you're speaking to your representative choice. And so the first category I think we will go to is economic justice. And we have here Katie with the California Work and Family Coalition to speak to both of these items. So the next slide is Assembly Bill 123. So Katie, can you tell us why California should pass Assembly Bill 123?
Yes, and thanks so much. It's such an honor to be part of this conversation. This is such an amazing day. So this is an Assembly Bill 123 and also a budget ask because this issue is so important. And so what our state disability insurance fund and paid family leave funds are designed to do is really provide us with income when we're sick, when we're bonding with a new baby or taking care of a seriously ill family member. And we actually, as workers, all fund these, are funding this ourselves. And we know that right now that wage replacement rate is too low for low wage workers because it's only 60% of your paycheck. And so what we really need to do is increase the wage replacement rate to 90% so that we all can use these funds. What's adding extra urgency this year is if the legislature takes no action, the rate will actually go back down to 55%. And we feel like after the pandemic, the last thing that we need to do is decrease the wage replacement rate for these really important programs.
Great. The next bill we have is Assembly Bill 1041. Katie, can you tell us why California needs this one?
Yes, so we have laws that allow us in California to take time off to care for a seriously ill family member. But right now that family member is defined pretty narrowly and doesn't reflect how most families actually are in California. And so what this bill would do is it would allow people to care for a designated person, so someone that they choose, which would really make these laws work much better for the LGBTQ community, who a lot of times their chosen family are the ones who are caring for them, and also for immigrants who are more likely to live in multi-generational families and might rely on aunts, uncles, nieces, nephews, family members who aren't currently included in this law.
Great, thank you so much, Katie. So folks who are joining us for the legislative visit portion of our day, you'll have the opportunity to uplift these bills in your meetings. And you can always reach out to Katie if you have any questions. All right, thank you. Next category we have is community safety. And we have invited here Nate and Sarah from the Asian Prisoner Support Committee. Oh wait, no, first we have D'Angelo. If you can speak to the Crisis Act, D'Angelo, and tell us why California needs to pass Assembly Bill 118.
I sure can. So first of all, this bill will establish a 5-year grant pilot program to to fundamentally improve emergency response for vulnerable populations in California by strengthening, expanding, and promoting community-based responses to emergency situations. Young people of color, people with disabilities, people who are gender nonconforming, people who are likely to face disproportionate police contact, people who are formerly incarcerated, people who with immigration status issues, and people who are unhoused or homeless need to be able to safely access quality emergency services that are culturally appropriate and from trained professionals with relationships and track records of service in their communities, instead of being met with armed responders or being connected to the criminal legal system. This is why California must invest in the community-based response and pass AB 118.
Thank you, D'Angelo. All right, now we have Sarah from the Asian Prisoner Support Committee. Can you tell us why California needs to pass Assembly Bill 937?
Hi everyone, thanks Gabby. I'm actually from the Asian Law Caucus, but I absolutely love Asian Prisoner Support Committee. They're a great partner. So the Vision Act, AB 937, first for some context, when Black, Latinx, and API refugees and immigrants are found eligible for release from jail or state prison, meaning that they finished their sentences or been found suitable for parole, they are treated differently from every other Californian. Our state prison system, CDCR, and local jails make arrangements with ICE so that instead of being released to their families so they can be, begin their reentry plans, they are arrested inside our prison and jails by ICE and funneled into ICE detention for deportation. California should not be voluntarily assisting ICE because transferring people from jail or prison to ICE worsens their health by lengthening their time behind bars and contributes to intense trauma when communities are permanently separated through deportation. The Vision Act, AB 937, would ensure that, like any other Californian, an immigrant community member who has served their time would not face a second punishment through ICE detention or deportation, and instead reunite with their loved ones. Thanks.
Thank you so much. These are both two really powerful pieces of legislation. So also looking forward, if you get to speak to these in your legislative meetings today, you can look to our talking points document for more. Thank you, Sarah. All right, now we have healthcare access. And I'm going to first ask Kiera from the San Diego County Breastfeeding Coalition why California needs to pass Senate Bill 65.
Hi, everybody. Thanks to all for putting this together and your undying support. So a little bit about SB 65, otherwise known as the California Momnibus Act. This is not only a timely, but also very significant legislation. Standing today, there are a lot of different parts to it, so I'll summarize it really briefly. First, it really improves and focuses on expanding postpartum care to 1 full year and extended Medi-Cal eligibility for postpartum people, provides doula care, invests in the midwife workforce, and also supplies of nice cash assistance for very low income people during pregnancy and in the early years, the early first period of an infant's life. It also restructures the state boards, the Maternal Mortality Board and the Pregnancy Review Board. These are really outdated and they do not align with the needs of the current California maternal population, and significantly puts Black and Indigenous infants and moms at really a significant risk for poor health and socioeconomic outcomes. In California, we are one of the most richest and economically advanced states in the nation. And we should not be seeing the rate that we are seeing of infant and maternal death in Black and Indigenous communities. Each of these are a life and a loved one lost. It should be taken very seriously. Every life matters. And as policymakers and advocates, we need to be able to uplift this bill, get it through. It's our due diligence to really support all constituents and make sure we leave no one behind. And that is
SB 65.
Wonderful. Thank you so much, Karen.
Got it.
All right. Next, I'm going to ask Yvonne from the California Immigrant Policy Center to tell us why California needs health for all. Yvonne, if you're talking, we can't hear you. Okay, must have fallen off. We can come back to this one. All right, our next category is healthy food access. And so I'm going to pass the mic to myself and ask myself, Gabby, why does California need to pass Senate Bill 464, Food for All? This bill would make all immigrants eligible for vital food assistance, regardless of immigration status. And this is absolutely critical to pass now because our immigrant communities are hurting, and not just because of the pandemic. That's because there are systems of disadvantage and discrimination that put many undocumented immigrants at a real disadvantage for being able to live their healthiest lives. And food is critical to that. Right now, our system discriminates against immigrants so that in a household with a documented child and an undocumented parent, even if they do get CalFresh, they're going to get a really small amount because they act as if the undocumented person just doesn't exist. It's time we need to stop erasing this entire community from our conversation and acknowledge the contributions that they make to California and make sure that they don't have to endure the indignity of hunger. Okay, and then our next bill is Assembly Bill 221. This is emergency food for all by Assembly Member Santiago. And California needs emergency food assistance because while the Food for All bill is a permanent solution to food insecurity in immigrant communities, our communities are hurting because of the COVID-19 pandemic. And there's been a disproportionate impact on immigrant communities, whether they have lost their job due to layoffs and the inability to get unemployment insurance, or if they're still working in essential jobs and risking COVID-19 infection to keep our economy running. This community has been left out of aid and is experiencing hunger at higher rates than anyone else in our state. This would allow California to issue grocery cards to these communities so that they can buy what they want at the grocery store and not be reliant on food banks and food boxes of ingredients to put food on the table for their families. So both of these are incredibly important for us to pass now and for the future. Okay, our next category is equitable governance. And I'm going to pass this to Jason first from the California Association of Student Councils to tell us why California needs Assembly Bill 46.
Hi, everyone, and thanks so much, Gabby. My name is Jason. I am a high school senior from San Francisco. And I represent the California Association of Student Councils. We're a student-run, student-led organization that wrote and developed this bill, and we're really excited to sponsor it as it moves forward through the legislative process. The Youth Empowerment Act creates California's first statewide youth commission for 25 members between the ages of 14 and 25. And one of the core aspects of the bill is that at least half of the members must have lived experience with youth homelessness, juvenile incarceration, foster care, or disability. So really about centering the conversation, empowering communities that often have the most contact with state government and are most impacted by state policy, yet seldom have the resources to advocate for themselves. So the importance of youth empowerment and listening to lived experience is essential for ensuring that California is spending its money wisely, is ensuring compassionate policies, and working towards a more civically engaged future for all of our young people. So we're so happy that this is part of the ENACT Day slate. Thank you.
Thank you, Jason. This is a really exciting bill, and Jason is a perfect example of the leadership that we can look forward to as a high school student and joining us today. So thank you so much. All right, our next bill is Senate Bill 17, and I will ask Wei from the California Pan-Ethnic Health Network to tell us why California needs Senate Bill 17.
Thank you, Gabby. Hi, everyone. My name is Wei Yu. I'm with CPAN. So, 2020 has really been a wake-up call. If there's one thing that we learned from the pandemic and the uprising supporting Black lives during the summer is that, it is not enough to just not be a racist. It's actually, we all need to, move towards the direction of being anti-racist proactively. And so that's why we need Senate Bill 17, sponsored by Senator Richard Pan. And so this bill would essentially establish an Office of Racial Equity within the state government. And it's important that we have an office like this, which would really coordinate across the different state agencies and departments to really address structural racism that's embedded in our government policies and practice and systems themselves, and to be able to coordinate the resources that we need for the state itself, for the state government itself to move towards a more anti-racist future. Thank you.
Thank you, Wei. And moving on to our final category, housing and environmental justice. We have our first bill, which is AB 71. And I'm going to invite Vince from the Prevention Institute to tell us about that.
Thank you, Gabby. So AB 71, as we know, housing is a determinant of health. Having quality, affordable housing prevents disease, trauma, and affords us the stability to live healthy, economically secure lives. To date, California has not invested in addressing the homelessness crisis to scale, and we rely on one-time general fund dollars in our state budget to produce affordable housing. AB 71 would ensure that the state generates $2.4 billion annually to end homelessness at all levels by strengthening our state's continuum of care system. Thank you.
Thank you, Vince. Okay, and our last bill is Senate Bill 624. And I will invite Paige from Fathers and Families of San Joaquin to tell us why California needs SB 624.
Yes, thank you, Gabby. Greetings, everyone. So SB 624, the Environmental Equity and Outdoor Access Act, commits to ensuring equitable access to California's rich cultural and natural resources. Accessing outdoor resources plays a vital part in promoting our physical and mental health, as we especially observed during the pandemic. Communities of color, immigrants, LGBTQ+ communities, and women often do not feel equally welcome and safe when accessing parks and green spaces. And based on where you are in the state, you might not have access to these green spaces. This bill would open up pathways with people in urban areas. Being stuck indoors last year and living in communities surrounded by concrete spaces without access to green spaces deteriorates mental health. Landlocked, lack of transportation, and paywalls like parking and permit fees are some of the factors that forbid many families access to green spaces. Many low-income families are denied access to these spaces, which require them to travel to distant regions that do provide green spaces, which they are faced with these, paywalls and transportation lack of those as well. And we can change that now by passing SB 624. Thank you.
Awesome, thank you, Paige. All right, I want to go back to our Health for All bill. I'm not sure if Ivan or someone from CIPC has been able to join us, but I know we have a lot of folks on the call who are advocates for this movement, and wondering maybe if someone else on the call could tell us why we need Health for All. And this bill would expand full scope Medi-Cal coverage to all, regardless of immigration status. That is the Assembly bill. And it's a package related to the Senate bill, which is Senate Bill 56, which expands full scope coverage to our elders.
Hi, may I share?
Please.
Good afternoon. My name is Jessica Martinez from Centro Binacional. We are being informed by indigenous community members who are farm workers and have been identified as essential workers based of the pandemic. As many of you know, a lot of farm workers are undocumented, don't have any immigration status, or are not able to receive full coverage of Medi-Cal. And Health for All would support some of our essential workers, will support essential workers with the health services that they will need, especially during this pandemic. And we know that not just during this pandemic, but before, we have not had these services before. So it would support essential workers.
Awesome. Thank you so much, Jessica. I knew we had an advocate amongst us because we all are advocates. And that's what we're going to move into now. Once we've introduced our bills to you, we're going to get everybody ready for the next section, the most exciting part of our day, our legislative visits. And we have a lot of resources ready for y'all. And so I will pass this over to Marcel.
All right. Thank you, Gabby. And so some of what we do today is classified as lobbying. And so really quickly, just running through, what that looks like and what that is. And, there's also an opportunity. There's a lot of bills, on the schedule for today, but even just sharing around issue area advocacy is also welcomed. And we need a little bit of both as far as, advocating on specific bills, but also, the larger areas as it relates to the social determinants of health and the issues that we uplifted throughout the earlier part of today. Next slide. All right, so for me, and I know for a lot of other advocates here as well, the most important part of the meetings are really sharing your lived experience, your story, and sharing that with policymakers to allow them to make more informed decisions. And so, sharing how you've been affected by these issues, either you, someone in your family, someone in your community. We definitely want to create the space throughout these meetings to allow you to share that experience, and even afterwards in creating ways that we can continuously ensure policymakers understand and hear from constituents as it relates to, how issues are impacting our lives, but also being part of creating those solutions moving forward. Next slide. All right, so you should have all received information regarding which group you're going to be in today for legislative visits. If you have not, no worries, there's still time. And so feel free to utilize the chat box. I know a couple of you have reached out and we've done some behind the scenes work to ensure that you're linked up with a group. So there's about 8 groups today. Legislative meetings will begin at 12 and go up until 2. And so each group has their own Zoom link. And so there's about 8 different Zoom links. And so just to ensure that you have the right information, you're in the right group. Again, if you have not been assigned just yet, feel free to utilize the chat box and we'll make sure that you have information, and just note that we are wrapping up here shortly. And so some groups will start to kind of game plan, introduce themselves and, assign roles for the meeting starting at 11:30. And so those meetings will begin again at 12. And so you have some time to game plan with your group if you have not been assigned just yet, or if you completed your registration and didn't indicate that you wanted to participate in ledge visits, feel free to let us know. There's still time. We would love to have all 128 folks here today join us through those ledge visits. So I think we have time for a couple questions. If there's any questions regarding, materials, what meetings look like, or even just what group you're in, or if you want to be in contact with your lead. If you have not, we have some time to coordinate that. All right, so I see some stuff coming in the chat. Feel free to continue to utilize that. I know that we will be going to a closing here shortly, but some of us will remain here just to ensure everything's situated. And so again, if you have not been assigned a group just yet, haven't received the Zoom link, feel free to let us know and we'll make sure you're connected with a group lead. All right, so while that's going on, I think I can go ahead and pass it over to our MC for the day, D'Angelo, to go ahead and close this out. And then I don't know if you want to take a question since we have some time here, but I'll go ahead and kick it over to you, D'Angelo.
Thanks, Marcel. Wow. What a great time together we've had. This is not the end, maybe the end for some that aren't joining us, but the fun continues this afternoon. Again, like Marcel said, we will be opening Zoom links for ledge visits at 11:30. We'd love to have lunch together, strategize a little bit more around the visits we'll be making today. So if you are assigned or have your assignment, you can click into that Zoom link, and your respective room leader should be there to give instruction. But this will be a time to grab some lunch and talk a little bit and prepare for this afternoon. For all those that are headed away from us, and we ask that you enjoy your day, and even more so, have a relaxing weekend. We really, truly appreciate you joining us for this year's ENACT Day. Be on the lookout for emails from the ENACT team, which will include the recording and other information around our speakers and bills that we're supporting this year. Once again, thank you to the Planning Committee and the Advisory Committee for establishing this day for us. What a wonderful job. And with that, again, we thank you, and we look forward to seeing you again next year. Have a great one.
I'm heading into our visits. Bye, everybody.
Super exciting.
Hey, can I ask a question before you guys leave?
Yep, you sure can.
This is Bill about AB 71. It says in here that the, and I want to make sure I read this correctly. One of the things it does, it requires for contracts with complete statewide gaps and needs and analyze to determine the resources available to address homelessness in the state. How long you think that would take? Are they looking to, is this looking like a 2-year thing, a 3-year thing, a 4-year thing? And because I didn't see timelines on here. And is the COVID federal government, is the COVID match going to help with this? And is the federal government going to help with this under their new infrastructure plan?
Yeah, I think in terms of the messaging for AB 71, there definitely needs to be a tie to